Good afternoon everyone. Today we are going to see about the procedure Naso-Gastric insertion. So what is Naso-Gastric insertion?
Naso-Gastric tube insertion is a method of introducing a tube into the stomach through the nose. It is a common nursing procedure used to provide nutrition and administer medication in patients who are unable to take medications and food.
What are the indication and purposes?
Indications for unconscious patient and oral intake patient. To feed a client with a fluid when oral intake is not possible, to dilate and remove the consumer poison, to instill the ice cold solution, to control the gastric bleeding, to relieve vomiting and distension.
And we will also giving to the patient who had undergone surgery. Immediately after the surgery they can't swallow the food. The main ultimate goal is to provide food. Okay, food and medication to the patient who cannot take oral. Okay, next. What is the articles used for this procedure?
Sterile tray
containing naso-gastric tube for feeding, drainage and medication administration, 10 ml of syringe for gastric tube aspiration, and lubricant jelly for reducing the discomfort, cotton balls to clean the nostrils, kidney tray collecting the waste, adhesive tape to secure the tube, and disposable gloves to protecting the patient and nurse to infection, stethoscope to auscultate, stethoscope used to help the tube placement, and pen to measure the length of the tube. That's it.
Next is how we are going to do the procedure. I will explain, you just demonstrate on the done. So first thing is we have to get the we have to check the doctor's order whether it is needed to the patient or not. Then we have to get consent from the patient and the patient attendant. If the patient is unconscious, you can also get consent from the patient. If the patient is unconscious, you can ask the attendants that we have to explain the procedure to the patient or to the client first. After explaining, you have to get the consent form. After getting the consent form, first thing is you have to arrange the articles near to the bedside of a patient. Then we have to provide privacy. No attenders should be inside, only doctors and those who are going to perform the procedure, they should be available inside the area. The next thing is we have to arrange the articles. Whatever the articles you have said, that is articles, it should be present near the bedside. Then the next thing is you have to make the position of a patient. Whether if the patient is in unconscious state immediately after the surgery means we can place the patient in a supine position, then we can administer. If the patient is in conscious mode or they are able to identify what is happening, make the patient sitting or in the Fowler's position. So make the bed in Fowler's position. Yes. So Fowler's position is the patient should be in 45-degree upright position. After placing the patient in upright position, you have to check for the nostrils, whether it is clean, clear or not. Okay, check. Before the procedure, you have to do hand motion. Okay. After hand motion, you have to do the gloves. You have to done it with the gloves. Wear the gloves. you have to clean the nostrils. After cleaning, you have to assess in which nostril the breathing pattern is clear. After assessing only, you have to insert the NG2. Okay, now take the NG2. How will you measure? So the NG tube measurement is, you have to measure from the tip. You should hold the NG tube like this, from the tip of the nostril to the earlobe, from the earlobe to the xiphoid process, which is the end of the sternum. After assessing, you have to mark it with a pen. So this is the measurement of our patient. Now you have to lubricate the NG tube for 1 to 2 inches. Yes, lubricate. First thing, you have to instruct the patient. It will be causing irritant to you, so you have to swallow. Whenever you feel difficult, you have to swallow. If you have coughing or irritating sensation, you should say that time you have to stop the procedure and you have to remove the tube. Okay. You have to say the patient to take it deeply and you have to swallow. Until the marked site is reached, you have to insert the tube. You should, if you face any obstruction during the insertion, what you have to do? You have to stop the procedure. Yes. Then secure it with the adhesive tape. So this is the procedure of insertion. So after inserting, how will you assess whether it is placed in a position or not? How will you assess? Two methods is there. Okay. First method is aspiration method. We have to insert a syringe. You have to aspirate whether if the gastric content is coming, it is in the correct position. Then you have to discard it in a kidney jar. And the next method is aspiration. How will you do the aspiration? 5 ml of TR, half the stethoscope. So you should place the stethoscope in the upper abdomen. Then you have to when you push, you will hear the air sound. So if you hear the air sound, it is in the normal position. Yes. Then what do you have to do? If any medication is there or if any feeding is there, you have to start the feeding. Then you have to remove your gloves, replace the articles. So this is the procedure of inserting naso-gastric tube. Yes, in the